Welcome to the American Nephrology Nurses Association's 50th Anniversary Podcast Series. In this commemorative series, past presidents and other leaders of the American Nephrology Nurses Association will provide a rich history of the association itself and of nephrology nursing as a specialty nursing profession. The American Nephrology Nurses Association's 50th Anniversary Podcast Series is brought to you by the Nephrology Nursing Journal, the official journal of the American Nephrology Nurses Association. We are honored to present this episode, and we hope you enjoy these invaluable and enlightening nephrology nursing recollections.
Hi, my name is Karen Robbins, and I'm the Associate Editor for the Nephrology Nursing Journal and the past President of ANNA. I have the good fortune today to be speaking with Suzann VanBuskirk, who served as president of ANNA from 2005 to 2006. Susie, thank you for taking time to talk with us today about ANNA, nephrology nursing, and your experiences.
Thanks, Karen. I appreciate the opportunity to be here and participate in these podcasts.
Well, this is part of our 50th anniversary celebrations. It's interesting to talk with people and find out how they became a nephrology nurse and where they first worked and what their experiences were. So if you could tell us a little bit about that.
Great. In May of 1977, after working in critical care for the first 6 years of my nursing career, I recall being intrigued by nurses who brought the dialysis machine to the patient's bedside. And I felt then that focusing on the care of the patient with kidney disease would allow me to concentrate on a specialty. And so after 42 years, I've never regretted that decision, moving quickly from staff nurse in the chronic outpatient unit to head nurse of the inpatient unit. And at that time, there had been a very large outbreak of hepatitis B among the patients and staff. Our medical director was very cautious and protective of his dialysis staff. So when I became pregnant, I moved into a staff education role. And following my maternity leave, I began work as the CAPD training nurse when Baxter first introduced peritoneal dialysis bags. Then following the acquisition of this hospital-based program in which I was working by BMA, which was the precursor to Fresenius, I became the head nurse of the entire home dialysis program, which eventually grew to 80 home hemo and 120 CAPD patients. I remember the emergence of Epogen, the hepatitis B vaccine, Fistula First, and many other exciting initiatives. And at no time, Karen, during my career have I ever said no to an opportunity. So I've had the opportunity to work with wonderful nephrology nursing colleagues, nephrologists, social workers, dietitians, and business leaders in acquisitions, business development, and facility, regional, and national administrative roles. And in my early days, I was fortunate to work closely with Janelle Parker, was introduced to ANNA in 1980 when Nancy Sharp visited Indianapolis. And from there, I became an active member of local, regional, and national ANNA activities, including serving as national president from 2001 to 2003.
Well, you certainly had an interesting career pathway and have done a variety of things in nephrology nursing, which I think clearly just underscores how many opportunities there are within this specialty to move in many different directions. So talking about your participation in ANNA, let's talk about your role as president. While you were president, you had a very active legislative and public policy agenda. Can you describe some of those highlights for us, please?
Yes. During my presidency, as you said, I was passionate about the need for nephrology nurses to be included in decision-making at local, state, and national levels. And during my year, we hired a D.C. lobbying firm, Gardner, Carton, and Douglas, who was selected to replace our current legislative consultant, Nancy Sharp, who was moving on to other interests. And many changes to coverage of ESRD was happening at that time. And it became, I felt, very important for ANNA to continue its education of its members and to seek opportunities to represent nephrology nursing at CMS, stakeholder meetings, and to ensure that appropriate funding for nursing education and public health initiatives continued and were in the forefront.
Okay, and I believe there was also some report through CapWiz about the dialysis composite rate and even a letter to then President Bush. Is that correct?
Yes, that is correct. We also were very clear and precise in what we felt was important to be included in that composite rate for the patient who was on ESRD and receiving funding through Medicare.
I think that one of the things that was really pivotal during your presidency was the response to hurricane and providing hurricane relief for patients as well as supporting facilities. And it was helpful and became a model for managing future catastrophes and how to intervene in those. Please describe some of that for us, if you would, please.
Yes, Karen, I was born in New Orleans, and ANNA had just held one of their best attended fall meetings in this great city of New Orleans the year prior to Katrina. And so when the hurricane came about, I was traveling, was much relieved to hear that the levees had held and things were going well until finally the levees broke, and there was a mass exodus of patients as well as caregivers to other places. And I firmly believe that nurses are necessary to participate in intervention and responses to national disasters such as hurricanes. So we participated in stakeholder meetings, and I believe that Norma Gomez had participated in those types of initiatives several years prior when hurricanes
I believe that's correct, yes.
her area in Florida. And so we were very active in ensuring, number one, that patient and patient caregivers and families received what they needed, and the care was coordinated to ensure that the patients had what they needed. So we were very proud of that.
As well you should have been. Other things that happened under your leadership was the effort to have recognition from the American Nurses Association of nephrology as a nursing specialty. Please tell us about that.
Yes, I view the recognition from ANA of ANNA as a specialty organization to be kind of the capstone of my presidency. However, as with any of the association's accomplishments, the application process was driven by Beth Ulrich and Caroline Counts, other members of the association. But I believe that it legitimized our own scope of practice and our standards of care. And it has allowed us to work alongside many other professional specialty nursing organizations and has served us well throughout the years since this occurred.
Yeah, I would agree that prior to that, even though ANNA was involved in the National Federation of Specialty Nursing Organizations and the Nursing Organization Liaison Forum, we were not at that time formally recognized by ANA as many of the other specialties were. So I think this was a significant move forward in recognizing our specialty. I thank you for that.
And we thank all those who participated in that, Karen.
Absolutely. You said in the State of the Association document in 2006 that, I would quote, "It has been estimated that the majority of ANA members have been affected by the recent consolidation of large dialysis providers. In the midst of these changes, I've heard members describe the greatest value that ANNA brings to nephrology nursing is the provision of forums where they can gather free of competitive pressures to promote professional growth of individuals and make a difference in the lives of patients to whom they provide care," end of the quote. I know that you spent the last few years of your clinically active career in an outpatient dialysis unit, and I wonder if you can share your thoughts about the possible role of professional associations and specifically ANNA in the lives of those nurses, and if they feel isolated, how this might benefit them.
Yes, Karen, I still believe this statement that I wrote 13 years ago is true today. And one of the reasons I believe this is because I have been personally impacted by ownership change at least 5 times in my professional career. And in my 10 years in acquisitions and integration, I have assisted hundreds of others through such a transition. So I guess this is why I feel so passionate about the value of ANNA to the individual nephrology nurse in this particular area. Since my presidency, I continued to work in leadership roles in acute and chronic dialysis for about 8 years, eventually moving into staff nurse roles in these areas. But I don't feel that my move to a staff nurse role was negative, because it brought me back to working in direct care of the patient, and it provided me with an opportunity to work with new nephrology nurses and to provide them with support that they need and to help them build a healthy work environment, which is so critical to staff satisfaction. And it's something that ANNA throughout the past 10, 15 years has focused on and has done many studies. And I firmly believe that ANNA, again, and still does, provide that opportunity for nurses to come in an environment that is free of any competition and to work alongside one another to achieve better patient care.
Thank you. I think that just further reaffirms why ANNA has been here for so long, and we're celebrating 50 years of this organization. I'd like to thank you, Suzann VanBuskirk, our ANNA president from 2005 to 2006, and the years before and after that you have contributed so much to our association and to nephrology nursing. We really appreciate your time today, and thank you very much, Susie.
And Karen, if I could just have the last word in this interview to thank you for your continued and professional support of ANNA. Your leadership of this podcast project is a fitting example of this.
Thank you very much for your kind words, Susie.
The American Nephrology Nurses Association's 50th anniversary podcast series is brought to you by the Nephrology Nursing Journal, the official journal of the American Nephrology Nurses Association. This series is owned and produced by the American Nephrology Nurses Association. All rights reserved. No portion of this podcast may be used without written permission. For archived episodes of this podcast and to learn more about the American Nephrology Nurses Association, visit the association's website at annanurse.org. You can also subscribe to this podcast on iTunes, Google Play Music, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and other various podcast delivery services.